Hello everyone, my name is Sakshi Jagdai. Today's topic: the sources of the adverse event, the reason for adverse event collection and the collection and reporting, in which collection and reporting the most important responsibility of investigators and a sponsor and clinical research to studies in this important to protection of human subjects collection protection of human subjects, collection of the clean and reproducible data, regulatory perspective, and then they need also they need to analyze the data and determine then then risk or benefit before giving a permission to market. Then adverse event. What is adverse event? Adverse event, any untoward medical occurrence in a patient or a clinical investigations, uh, clinical investigations subject administration of pharmaceutical product, and which does not have a necessary relationship with the treatment as per ICH E2A. And the an adverse event can therefore be used to any unfavorable and unintended drug, and including an untoward and unfavorable drug, including an abnormal laboratory finding, symptoms or disease, and the un, and the unwanted effects in this unwanted effect unwanted effect in these symptoms, that is headache, nausea, headache, nausea, and the physical finding, that is elevated BP, lump, edema, and also the abnormal lab values. And then the overdose important to define what percent cut offs be taken as a adverse event. Then adverse event can also be unfavorable um, deviation from the baseline health, mm, uh, which include the worsening of the condition present at onset of the study, patient deterioration due to primary disease, and the patient intercurrent illness. Also, the event related or possibly related to concomitant medications. The examples of the unfavorable deviation from baseline health, which include um, which include the headache present in baseline was mild, now become a saver. Then also the unfavorable deviation from baseline health, which include patient deterioration due to primary disease, and the BPH study patient and the BPH studies patient going into acute retention of urine, and also antibiotic study, that is URTI, progressing to lower respiratory tract infections. Mm, example, due to the concomitant medication hypertension trial. Also the PT comes with the diarrhea, interrogation, had taken antibiotics and become of URTI. adverse uh, Adverse drug reaction in the pre-approval clinical experience, that is also all noxious and unintended response to medicinal product, unintended response to medicinal product related to any dose should be considered adverse drug reactions. Mm, then the regarding marketed medicinal product, adverse drug reaction in the post marketing setting, and also a response to drug, and also response to drug which uh, which is which is a noxious and unintended, and which occur at a dose normally used in man for prophylaxis, diagnosis, also therapy of a disease, or modification of physiological functions. Mm, then unexpected adverse drug reactions, and adverse reaction, the nature or severity of which is not consistent with the applicable product and the information. Example: investigator voucher for an approved investigational medical product, and a seriousness adverse event or reactions, that is any untoward medical occurrence that at any dose that is result in death, life threatening, require required inpatient in hospitalization or prolongation of the existing, then hospitalization result in persistent stunt or significant disability, then is congenital anomaly or the defect, then suspected and unexpected serious adverse reaction is the serious unexpected adverse reaction. So serious unexpected adverse reaction is the um, nature or severity, of the one the nature of severity which is not consistent with the information in the relevant source document, and also the in the seriousness intensity relationship to the drug, and expectedness and unexpectedness, and serious adverse event or reaction, any untoward medical occurrence that the result in death, life threatening hospitalization, prolongation of the existing hospitalization, and the important medical event judged by the investigator. Then life threatening adverse event, that any adverse event that places the patient or subject in the view of the investigator at the immediate risk of death for the reaction as it occurs. Example: pacemaker failure and gastrointestinal hemorrhage, infusion pump failure, excessive IV fluid dosing, and toxic drug level. Then disability, substantial description of the person, ability to conduct normal life functions. Example: stroke, loss of limb, toxic drug level, hearing loss, and blindness. Other example of several adverse event system, that is the important medical events. Example of a such event as the intensive treatment emergency in the emergency room, and the intensity in the adverse event, that is the mild, moderate, and severe. Then the example: dizziness, patient feel the symptom but can go on the routine activities. Then the non-serious adverse event with the mild intensity, myocardial infarction, etc. And also there are the WHO UMC casualty categories: unlikely, conditional, and unclassifiable, and the common used adverse event relationship with the study product, that is the definite, probable, possible, and the non not related. Thank you.